welcome back. Hope you enjoyed your breakout session. So our next panel today is called The Need for a Creative Approach to Tackle Mental Health Inequalities. And I'm delighted to welcome Emily van der Venter, who's chairing this session. Emily is lead consultant for mental health at Public Health Wales. And this panel discussion will focus on inequalities in mental health and wellbeing and consider how the creative sector can contribute to improving equity in mental health and wellbeing and broader health outcomes for people experiencing mental health difficulties. Thank you very much. I'd like to welcome Emily.
Diolch yn bore da. I'm Emily, as been said, and just going to have a short session now to explore in a little more depth some of the inequalities experienced by people with mental health difficulties and how the creative sector can respond. So we know that risks of experiencing mental illness are a result of a complex mixture of individual, social and environmental factors. We're all absolutely susceptible to developing mental illnesses, but we know some groups are more susceptible than others, largely due to contextual social factors that they experience, reflecting wider inequalities and injustices in society, things like poverty, insecure housing, experiencing stigma and discrimination being really key factors. So in Wales in 2022, around a fifth of households were living in relative poverty. So that is having an income of less than 60% of the UK average. And about 28% of children were living in relative poverty. The 2021 census showed us that we have an important population of people from minority ethnic backgrounds. 10% of people living in Wales from non-white British backgrounds. And we also have a small but really important group of Gypsy, Roma and Irish travellers, around 6,000 people living in Wales. And they're a group that can experience real inequalities due to being excluded from society in many ways. So inequalities in mental health, as I say, can be realised in terms of population groups who are at higher risk of developing mental illness. Unfortunately, those groups of people are often face additional barriers in terms of accessing services, and when they do access services, they experience differences in terms of outcomes and poorer outcomes. So to help us explore the topic of inequalities in mental health today, I've got some fabulous speakers with me on the panel. Got Dr. Habib Naqvi, who is the Chief Executive of the NHS Race and Health Observatory, which works to identify and tackle ethnic inequalities in health and care. Dr. Naqvi has over 20 years' experience working in public health and the NHS and was awarded an MBE in 2019 for his services to equality and diversity in the NHS. We've also got Lexi Island, so Habib and Lexi are with us on screen. She's the strategic lead for health inequalities at Coventry and Warwickshire's Mental Health Trust and is leading innovative approaches to tackle health inequalities and transform mental health services through co-production with people with lived experiences and collaboration with voluntary and community sector organisations. And her work to reduce inequalities for people living with severe and enduring mental illness has recently been nominated for an HSJ award. With me in person, we've got Nerys Edmonds. She's the Principal Health Impact Assessment Development Officer with the World Health Organization Collaborating Centre based within Public Health Wales and brings a wealth of experience from a background in mental health nursing, working within the NHS, public health and the voluntary and community sector, all the while aiming to promote mental health, wellbeing and reduce inequalities. She's also authored some influential reports, including health impact assessments on Brexit and climate change, and the Mental Wellbeing Impact Assessment Toolkit, which is used widely across the UK. So really pleased to have them with us today, and we'll first go to Dr. Habib Naqvi to please offer some insights in terms of mental health inequalities that the Race and Health Observatory have identified. Thanks, Habib.
Great, thank you. Thank you so much, Emily, for the introduction. Hopefully you can hear me speak. Yes, with a thumbs up, fantastic. Thank you for the introduction as well. I'm sorry I can't be with you today, this afternoon, even though I don't live too far from Wales in Bristol, but I am in Windsor today, looking at global health and organisation called the NHS Race and Health Observatory, which was in fact established just before the pandemic, and established to focus on tackling ethnic and racial inequalities in health and healthcare. And I guess our healthcare system, or systems, are perhaps the most visible expression of shared contract, social contract between people. And we saw that, of course, so vividly over the pandemic. But, of course, to be proud of our healthcare system is not to be blind to some of its imperfections. And the inequalities that we see in access and experience and in outcomes with regards to a range of conditions, including, of course, mental health, are some of the imperfections that we see within our healthcare system. So, and we know what the statistics tell us. We carried out a review ourselves within the observatory just over a year ago, which showed us that people from Black, African and Caribbean communities are 40% more likely than white British people to come into contact with mental health services through the criminal justice system. Black adults are more likely than adults in other ethnic groups to have been detained under the Mental Health Act. And of course, access to psychological therapies is lower amongst certain ethnic minority communities, whether that's Black communities or, as Emily highlighted, the Gypsy, Roma, tribal communities, compared to the white British majority counterparts. And the list goes on in terms of the different statistics, in terms of experience, in terms of outcomes that we see from our system, from our healthcare system. So I guess there is an urgent need for us to tackle these issues, and our countries should be well equipped to deal with this level of urgency for a number of different reasons. Firstly, we have a long history of migration in our countries, which goes back not just decades but centuries. We therefore have large and growing ethnic minority communities. Secondly, we have, to some extent, fairly robust legal frameworks in the Equality Act 2010 and the health inequalities duties that we have as well. And we've always had very good investment in healthcare research across the UK. And of course, the COVID vaccine is perhaps just one of a very long list of medical health-related innovations that we've seen over the decades, in fact centuries. But it can also be argued that our collective responses to these challenges have been somewhat fragmented. Okay, brilliant. I think I was on the point where I was saying there's an urgent need for us to focus on these challenges around bias, discrimination and racism in healthcare, and I guess...
Okay. Thank you. So sorry about the technical issues. If we can't get them back on screen in a moment, then we'll, Angela has suggested we'll have a network meeting when we can bring Dr. Nakvi and Lexi together. But we'll have a slightly different angle now from Neris. So she's going to talk to us. I'm not a theatre practitioner or anything. I'm not used to this ad-libbing. So, how are we doing? Should we give it one more go? Third time lucky. Back to Habib. Everyone keep your fingers crossed, please.
Do you want me to finish? Oh, yes.
Please.
Okay. I'll be very quick. I was on the point of our collective responses to tackling issues around racism and bias and discrimination in our healthcare system have been somewhat confused and costly and fragmented, and whereas organisations and systems have historically looked at surface level issues, they haven't looked at what we call the causes of the inequalities that we see. And in fact, that's a term not kind of coined by myself, but by Professor Michael Marmot.
Yeah. So we're going to have a slightly different angle now. So hopefully we'll get to hear from Habib another time from the race angle. I'm going to let that go in the background, and Neris is going to talk about the mental health impacts and inequalities associated with climate change. If you would.
Okay. Hi, everyone. I'm really disappointed not to hear all of Habib's talk, so, but I'll fill in and hopefully maybe we can get this back up again. So I'm going to talk a little bit about some work we've carried out in Public Health Wales looking at the health impacts of climate change in Wales, and we published a report in July, which was a comprehensive health impact assessment. And part of that work looked at the potential impacts of climate change on mental health and well-being, and also community resilience, and also different population groups in Wales that may be disproportionately impacted by climate change. And one of the sort of lenses that we looked at climate change through was a model of what's called climate disadvantage that the Joseph Rowntree Foundation developed actually way back in 2011. They were well ahead of their time. And it's a really useful model to help break down, to understand how different groups and people and different communities may experience disproportionate impacts from climate change. And some of that is linked to maybe how vulnerable or sensitive people are to things like increased heat and heat waves, or how much people might be exposed. So obviously, if you live in a flood risk area, you're going to be more likely to experience flooding, but also about the resources that people have to prepare, respond and recover from climate-related impacts, whether that's extreme weather or other changes. And obviously, all of those things together can lead to greater inequalities. So, for example, we've looked at different groups within the health impact assessment, such as rural communities, coastal communities. We've also looked at more vulnerable people and disadvantaged, such as people who are homeless, and also those who are more sensitive to the effects of the changing weather, including people with long-term conditions, including mental health problems and dementia. So just to come on to some of the mental health impacts of climate change, we know that being exposed to extreme weather and natural disasters can have a very devastating impact on people's mental health. And a long-term study in England found that people whose homes were flooded had 6 times the rate of post-traumatic stress disorder, anxiety and depression than people in the same area whose homes weren't flooded. And actually those effects last for most people, it will last for well over a year. So we know that many people will experience mental distress for quite a long period after being flooded. But actually, even people's homes whose homes weren't flooded, but they were still affected by the flooding in their local area, they also had a greater impact on their mental health. And then more broadly, from a sort of socioeconomic point of view, people on lower incomes or in poorer housing may experience worse effects because their house gets damaged, or they don't have the money to invest in adapting their home or repairing their home, or they may not have adequate insurance to cover them for various effects of climate change. So it could also affect their living conditions. We know that heat waves, extreme heat, can exacerbate symptoms of a number of mental health conditions, including dementia and schizophrenia. Another area where climate change can impact on mental health is where a valued natural environment is damaged or lost. And some really interesting research was done in Australia on this by a researcher called Albrecht and his colleagues, and they coined actually a new concept. I don't know if any of you have heard of this, called solastalgia. But solastalgia is the kind of sense of distress and loss that you feel when a valued place or in natural environment is damaged beyond repair. This original research was carried out in Australia, linked to climate change impacts. So, we may all feel a sense of solastalgia if, related to climate change, somewhere we love is damaged or lost. And then there is the kind of overarching kind of threat of, aside from whether you're directly impacted by an extreme weather event, there is the general threat of climate change and what it means for our future that causes people emotional distress and anxiety and concern for the future of the planet and people and nature. So there's a whole range of pathways through which climate change can impact on mental health. And actually the last one I'll just mention is about the way that we communicate about climate change and the way that policy is implemented. So the way that policy around flood defences or coastal policy is implemented can have a really strong impact on the emotional well-being of people living in those places and how much empowerment and engagement they have with making decisions about the future of where they live. So what's the role of arts and culture in this? I feel arts and culture have got a really, really important role to play here. I think in terms of helping people process their experiences, their feelings, and sharing those things. You know, we know how I know I'm talking to the converted here, so, but I think also there's a really important role in terms of people finding meaning in what's happening. I think we all struggle to see, you know, certainly I just talk about myself, you know, it's a very hard thing to come to terms with what is happening to our planet. And how do we find meaning and hope in that situation? And I think the arts have an enormous role to play. And I think actually Lynn Neagle mentioned earlier the value of purpose, meaning and belonging for our mental well-being. And I think that's absolutely the role that arts and culture can help us in terms of navigating the climate crisis. I think the other area it can help is in terms of our connection to each other. So building those connections, you know, our resilience is so much founded on our relationships to each other. But also, how do we relate to our future generations? What are the stories that we want to be told about this time, that we want to share with those future generations? You know, what is it to be alive in 2023, and what does it mean to us to be facing the climate crisis? I think that's a really important story for everybody. Looking at the kind of evidence-based approach, we know that expressive arts, you know, there's an evidence base there about expressive arts supporting people in the recovery from natural disasters. So I think there's a really rich, if you want to tap into an evidence base, I think there's a really good evidence base there. And I think finally, building community resilience and solidarity between people. I think the arts and culture has got a really important role to play in bringing people together, helping people support each other, developing those shared stories and that shared hope and vision for the future. So hopefully that's just a little taster, thinking about mental health inequalities and the climate crisis. But do have a look at our report. It's got a lot more detail on a number of areas about climate change. I'm going to hand back to Emily now, and we'll see where this session goes from here. Okay.
Thank you all for bearing with us. The connection has been too intermittent, so we, as I say, we'll invite Dr. Naqvi and Lexi Island to a future network meeting so we can all hear from them. I think Dr. Naqvi made some really important points there around the need to look at the causes, and of course climate change is a really important one there. He also mentioned a really powerful statistic for me that early on in his speech around people from Black, African and Asian backgrounds being 40% more likely to enter services through the criminal justice route. And that is not because they are more likely to be bad. That is because we have failed as a service to build that trust with some of these communities that enables them to come forward early when they are struggling. So we really need to do a lot more work to build that trust. And some of what Lexi was going to talk about is some of the actions they've taken in Coventry and Warwickshire to do just that. So please do join us for a future meeting, and thank you for listening.